Wait, if you are over 50 and your skin is itchy, don't scroll any further. What I'm about to say now may save your life. In my 15 years of work, I've seen hundreds of patients who ignored a simple itch. Do you know what happened in the end? Stage 4 cancer. Today I want to tell you a truth that general practitioners don't mention because they don't have the time, because they don't care. But I can't stay silent when people die because they don't know. Get ready. Right now you're going to learn 7 symptoms that should never be ignored under any circumstances. 2 years ago, a 58-year-old woman named Maria came to see me. She was complaining about itching on the palms of her hands. She had been applying cream for 6 months, thinking it was just dry skin or due to her age. I looked at her hands and froze. I immediately sent her for tests. A week after the diagnosis, it turned out to be stage 3 pancreatic cancer. Do you know what she told me? She said, if I had known, I would have come to you sooner. So, to make sure you don't repeat this mistake, listen carefully to every word I say in this video. Itchy skin in older adults is not just a simple itch. It's a distress signal from your body, especially if you are over 55 years old. The statistics are terrifying. According to data from the National Cancer Institute, in 30% of cancer patients, itching was the first symptom, long before pain, weakness, or weight loss. But 95% of clinic doctors just give you an allergy ointment and send you home, and that person dies a year later. Why does this happen? I'll explain it to you simply now. When a tumor or cancerous growth appears in the body, it releases toxins. These toxins enter the bloodstream. The liver tries to neutralize them. But when the toxins become too much, they start causing itching through the skin. The result is itching. In addition, cancer cells produce substances that stimulate the nerve endings. You feel the itch, but you don't realize that it's not your skin that's itching. It's the nerves that are sending the signals. But the most dangerous is paraneoplastic syndrome. What is that? It's a condition where the immune system tries to fight the tumor but mistakenly attacks healthy tissues, including the skin. Itching, skin rashes, and redness appear, and people think it's an allergy, dermatitis, or something like that, while in reality they have cancer. Research published in the British Journal of Dermatology on 16,000 patients revealed some shocking statistics. In people over 60 with chronic itching without a clear cause, the risk of cancer was 4 times higher. 4 times higher. Pay close attention. I'm going to give you 7 specific symptoms. If you have at least 2 of them, go see a doctor tomorrow. Not a week later. Tomorrow. Symptom number 1. Itching of the palms and soles, especially at night. This is a classic sign of liver or bile duct problems. And this often means pancreatic, liver, or gallbladder cancer. Why specifically the palms? Because they're full of nerve endings. When bile acids build up in your blood because of a tumor, they stimulate exactly these nerves first. If the itching gets worse at night, that's a serious warning sign. The liver is more active at night. Toxins accumulate more quickly. What should you do? Get tested immediately. Bilirubin, AST, ALT, alkaline phosphatase, and an abdominal ultrasound. Sign number 2. Itching all over the body without any skin rash. Pay attention. No skin rash. The skin is clear, but the itching is unbearable. This is almost always a systemic problem. There are 3 main reasons: lymphoma, leukemia, or internal organ cancer with metastasis. In lymphoma or cancer of the lymphatic system, 30% of patients experience itching, and often this is the only symptom in the early stages. Why isn't there a skin rash along with it? Because the problem isn't in the skin, the problem is in the blood. Cancer cells secrete histamine and cytokines, and those directly cause itching through the nervous system. The patient scratches themselves to the point of bleeding. They can't sleep at night. Doctors say it's stress or anger, prescribe sedatives, and 6 months later the cancer is at stage 3. What should be done? Do a complete blood test with leukocyte formula. Do an ESR test. Immediately perform a CT scan of the lymph nodes. Sign number 3. Itching accompanied by jaundice. Jaundice means when the skin and the whites of the eyes turn yellow. Even a little bit of it matters. If itching is accompanied by jaundice, in 70% of cases, it's pancreatic cancer. 70% means 7 out of every 10 people. What happens? The tumor compresses the bile ducts. Bile can't get out. It accumulates in the blood. That's when severe jaundice and itching start. Pancreatic cancer is one of the most aggressive cancers. It doesn't show any symptoms until the very last moment, but itching and jaundice are early signs. Remember, jaundice isn't always obvious. Sometimes you might just see a faint yellowish tint on your skin. Look at yourself in natural daylight. It's better to take a photo and compare it with a photo from a month ago. What should you do? Get a pancreatic ultrasound, a CT scan, or an abdominal MRI. Do tumor markers like CA19-9 immediately. Sign number 4. Itching in the anal area or genitals in older adults. People feel embarrassed to talk about this. They treat it with hemorrhoid suppositories. While this could actually be colon cancer or cancer of the genital organs. It's especially dangerous if the itching is accompanied by blood in the stool. Changes in stool shape like becoming thin like a pencil, frequent need to use the bathroom, or a feeling of incomplete evacuation. All of these are dangerous signs. In its early stages, colon cancer can cause itching because the tumor irritates the nerve endings. In women, genital itching after the age of 60 could be a sign of vulvar or cervical cancer. In men, prostate cancer can spread to the colon. Don't be embarrassed. Life is more important than embarrassment. What should you get checked? Colonoscopy. Yes, it's unpleasant, but it saves lives. In addition, women should have a gynecological exam and men should see a urologist and get a PSA test. Sign number 5. Itchy scalp with patchy hair loss. Not just dandruff, but actual itching. In addition, the hair falls out in patches. Bald spots appear. This could be cutaneous T-cell lymphoma. It's a rare but very insidious type of cancer. In its early stages, it presents as dermatitis or psoriasis. Doctors treat it with creams for years while the cancer keeps progressing. Regular antifungal and anti-inflammatory medications don't help. You treat it for a month or 2. It has no effect. Go see an oncodermatologist right away. What should you check? A scalp biopsy? This is the only way to make an accurate diagnosis in this case. Sign number 6. Itching accompanied by weight loss without dieting. If you haven't intentionally lost weight, haven't been on a diet, and have been eating as usual but still lost weight, in 80% of cases it's cancer. Itching plus weight loss is a combination that almost always means cancer. Why does weight loss happen? Cancer cells consume your resources. They feed on your glucose and protein and secrete substances that destroy muscles and fat. If you've lost 5 kilos or more within 3 months without any reason, this is an emergency situation. Add itching to that and the picture becomes almost certain. What should you check? A full examination, a whole body CT scan with contrast, tumor markers, complete blood test, gastroscopy, colonoscopy. Sign number 7. Itching along with enlarged lymph nodes. You have lymph nodes in your neck, under your jaw, under your armpits, and in your groin. They have become enlarged. They are hard. They are painless. Enlarged, painless lymph nodes along with itching indicate lymphoma or cancer metastasis. Remember, if the lymph nodes are painful, it's more likely an infection or inflammation. Nothing scary. But if the lymph nodes are enlarged, hard, and painless, that's cancer. This combination is present in lymphoma most of the time. Itching, enlarged lymph nodes, night sweats, mild fever, and a body temperature between 37 to 37.5 degrees. What should you do? Get a lymph node biopsy. That's the only way to know exactly what is. Now, the most important thing is, if you have these symptoms, what should you do? The first step is not to panic, but also don't ignore it. Itching is not always cancer. It could be diabetes, thyroid problems, kidney failure, or an allergy. But it's necessary to rule out cancer. The second step is to see a doctor tomorrow, not a general practitioner. They'll just prescribe you an ointment and send you home. Go directly to a dermatologist or oncologist and say, I've had unexplained itching for more than 2 weeks. I need a thorough examination. The third step is to insist on getting tests done. At a minimum, these should include a complete blood count, biochemistry, bilirubin, AST, ALT, creatinine, urea, and glucose. Tumor markers such as PSA and CA 19-9 for men and CA 125 for women. Abdominal and lymph node ultrasound, fluoroscopy, or CT scan of the lungs, if anything appears suspicious. A full body CT scan with contrast. The fourth step is don't believe it if they say it's because of your age. Itching is not normal at any age. It's always a signal of a serious problem. If your doctor is being negligent, go see another doctor. Your life is in your own hands. And now some important information. There are types of itching that are not cancer. We also have itching caused by dry skin. It appears in winter when the humidity is low, along with flaking of the skin. It also gets better after using a moisturizer. We also have itching caused by allergies. It comes with skin rashes and red spots. It appears after contact with an allergen and gets better with antihistamines. We also have itching caused by diabetes. It often occurs in the groin area, on the legs, and is accompanied by thirst, frequent urination, and high blood sugar. We also have itching caused by kidney problems. Facial swelling in the mornings, cloudy urine, changes in urine tests, and itching caused by thyroid issues, which comes with fatigue, weight gain or loss, and changes in heart rate. How can we recognize dangerous itching? Dangerous itching lasts for more than 2 weeks. It doesn't get better with regular medications. It gets worse over time. It interferes with sleep. It comes with other symptoms like weight loss, weakness, fever, or swollen lymph nodes. If you answer yes to even one of these, you should get examined. I want to tell you another story, and then we'll get to the checklist I want to give you. There was a 62-year-old man, I'll leave his name out. 6 months ago, his back started itching. He thought he was allergic to the new laundry detergent. His wife forced him to come see me. I examined him. His skin was clear, no rashes. I asked, "Have you lost any weight?" He said, "Yes, about 3 kilos in a month. But well, since I was itching, I got anxious and lost my appetite." I sent him for tests. A week later, we diagnosed stage 2 Hodgkin's lymphoma. Do you know what that means? We caught it in time. Chemotherapy, radiotherapy. It took a year after that for a full recovery. Now he's living his life. He's enjoying his life. If he had come 6 months later, it would have been too late. Do you understand? Early diagnosis saves people's lives. According to World Health Organization statistics, stage 1 cancer is treatable in 90% of cases. Stage 2 cancer up to 70%. Stage 3 cancer is treatable in 30% of cases. Stage 4, only 5%. It's the difference between life and death. It's just a matter of a few months, those same months when you ignored the symptoms, and now I want to give you a checklist. Write it down, save it, check yourself with it right now. This is the cancer self-examination checklist. You need to answer these questions with yes or no. Have you had itching for more than 2 weeks? Do antihistamines relieve the itching or not? Has the itching at night kept you from sleeping? Have you lost weight in the past 3 months without dieting? Do your skin or eyes look yellow? Have your lymph nodes become enlarged? Do you have persistent weakness and fatigue? Do you have a temperature of 37 to 37.5 degrees without having a cold? Do you sweat so much at night that you have to change your clothes? Has the color, consistency, or cleanliness of your stool changed? If you answered yes to 2 or more, go see a doctor tomorrow without any delay. If it was 4 or more, this is an emergency situation. Immediately request a full examination. And now, what should we do for prevention to reduce the risks? Rule number 1 is to have regular checkups after the age of 50. At least once a year, which should include a complete blood test, biochemistry, abdominal ultrasound, and for women, fluoroscopy, mammography, and a gynecological specialist examination. For men, a PSA test and a urologist examination are necessary. A colonoscopy every 5 years is recommended for everyone over 50. This saves lives. Colon cancer at stage 0 can be treated with a colonoscopy. The doctor simply removes the polyp and that's it. You become healthy. Rule number 2. Take care of your skin. Any new or unusual mole, any suspicious spot, or any wounds that simply do not heal properly should be shown to a qualified dermatologist. Melanoma, or skin cancer, is one of the most aggressive cancers, but in its first stage, it is 100% treatable. Rule number 3, maintain a healthy lifestyle and don't smoke. Smoking increases the risk of cancer by 20 times. Limit alcohol, especially strong drinks. Eat properly. Rule number 4, listen to your body. Any unusual symptom that lasts more than 2 weeks is a reason to see a doctor. Nothing happens for no reason. The body always sends signals. And I want to tell you something important as well. I understand that you're afraid of going to the doctor, afraid of getting tests done, afraid of hearing the diagnosis. This isn't just about you. Everyone has this problem. But do you know what's even scarier? Losing time. Cancer is not a death sentence if you catch it early. Modern medicine works miracles. But miracles are only possible in the early stages. I've seen people who have beaten cancer 10, 20, 30 years after treatment. They're living their lives to the fullest. But I've also seen those who came too late, when nothing could be done anymore. That's what's scary. It's painful, because it could have been prevented. Don't be among those who ignore the symptoms. Take care of yourself. Your family, your children, your grandchildren, they need you. They want you to be healthy. So I ask you, if you have even one of the symptoms I mentioned, don't put it off even for a day. Say, the doctor said I should get checked. If necessary, show these videos to your doctor as well. Most importantly, don't ignore it. Your life is in your own hands. If you found this video helpful, please like it. The algorithm will show it to other people too. You might save someone's life. Subscribe to the channel. A lot more important information about health is on the way. And most importantly, share this video with your relatives, especially your elderly parents. It might save their lives. And write in the comments whether you regularly get checked or ignore the symptoms. Let's go discuss. Remember, early detection saves lives. Don't ignore your body's signals. Take care of yourselves. Stay healthy. Live a long and happy life. Thank you for staying with me until the end of the video. Please watch these videos as well for more information. Until the next video, goodbye.